job. I'm a physician. I'm joining the deliver for both and staff in the detention facility. So far, we have detainees and 3 guards of COVID nationally. Last Sunday, while in ICE detention in Ohio, in that same facility, 47 of the 51 detainees in that tested positive for COVID. Here in Aurora, we understand that detainees only have masks sporadically. At some point, I believe they were getting them Monday, Wednesday, and Fridays, which clearly doesn't make a lot of sense. We understand that detainees are now being housed with 8 persons in one cell where they cannot practice social distancing. And lastly, we have recently heard reports that detainees are not allowed to shower alone. So if they want to shower, they have to shower together. All of these actions on the part of GEO put the lives of both detainees and staff at risk for contracting coronavirus. GEO is responsible for the health of every one of the detainees in this building. They are currently putting the lives of all those detained here and their staff here in jeopardy with their inexcusable safety practices. As healthcare workers, we know that the only safe way to stop the spread of COVID-19 and ICE detention is to release all people detained. We cannot stand by if people die in detention. Today, we are delivering these masks to provide the people inside added protection from disease while we await the real needed change, an end to immigration detention. Release of all is needed as soon as possible because COVID-19 in detention facilities is a public health emergency. Thank you.
Thank you, Danielle. Jenna, would you like to share why you're here today?
Sure.
Oh, wait, can we translate first for our folks that are joining at home in Spanish? Voy a traducir por la compañera que acaba de dar su testimonio. Ella es una doctora, Danielle Loeb, que está aquí participando en entregar estas máscaras, estas cubrebocas que son a la calidad de los hospitales N95 a las personas aquí adentro. Ella está aquí participando porque esto es para proteger la seguridad de las personas, los detenidos, tanto como las personas que trabajan aquí adentro. Ya hemos visto que en otros centros de detenciones donde se ha habido se ha estado compartiendo esta pandemia entre los detenidos, ya es una crisis y queremos prevenir que eso ocurra en este centro de detención. Así que estamos escuchando también que las personas allá adentro, los detenidos, nuestros seres queridos, solo están recibiendo mascarillas y cubrebocas unas cuantas veces por semana. Eso no tiene sentido. Necesitan una mascarilla nueva al menos cada día, si no a cada cuantas horas. Entonces, por eso están aquí tratando de entregar estas mascarillas para a ver si pueden al menos proteger un poco más a las personas aquí adentro y están llamando por más protecciones para las personas, pero más que nada están pidiendo que liberen a las personas aquí adentro porque eso pondría más en seguridad a toda nuestra comunidad y a las personas detenidas y también a los que trabajan aquí adentro. Ahora una estudiante médico va a compartir su testimonio.
Hi, my name is April Browning. I'm a practicing physician. I'm here at this action today to help deliver 510 masks to help with the people who are currently imprisoned in the Aurora ICE GEO Processing Center. As a physician, I believe that it is very important that regardless of how somebody entered this country, that they be treated with dignity and respect. And we need to treat our fellow human beings well. And in a setting of an infectious pandemic, this could be a death sentence for the people who are imprisoned as well as the guards. And it is just ethically wrong that people are being kept at 7 people to a cell where they cannot practice social distancing. It is deadly. Advice that we're giving to our patients is the coronavirus does not transmit itself, but people transmit the virus. We're advising people to stay away from other people to avoid contracting and spreading this deadly virus. And while we know that there's certain populations that are at higher risk, including the elderly, those with multiple medical conditions, also those who are disadvantaged with lower socioeconomic status. And inadequate access to hygiene, inadequate access to soap, to cleansing, to masks. People in those situations are at higher risk of dying of this disease, regardless of how young you may be. This is an unprecedented situation. We have never been through anything like this before, and the right thing to do is to find alternative solutions, to find a pathway to citizenship for these people, to release them all, to get them out of these cells, get them out of these unsafe conditions, because we are ethically responsible for the people that are being imprisoned here. And we must do a better job. And we're going to try to do what we can by delivering these 510 masks today to help with respiratory protection. But we know there's other methods of transmission of this virus as well. There can be fomite contamination. You can have virus on your hands, and you can touch your eyes, nose, or mouth and get contaminated. And unfortunately, these people do not have the means to protect themselves, to stay healthy. And this is cruel and unusual punishment, and it is wrong. And I stand up against it. Thank you.
Thank you so much.
Esta es otra doctora que está aquí participando para entregar los cubrebocas. Piensa que es falta de ética que las personas aquí adentro estén pasando por estas condiciones. Siente que es la responsabilidad de doctores y de toda la comunidad de proteger a todas las vidas, que ellos tengan la dignidad durante esta pandemia. Sabemos bien que las personas pueden contraer este virus, aparte de por el aire, también tocando cualquier superficie que esté contaminada y se toquen los ojos, se toquen la nariz, se toquen la boca, podrían contagiarse de esa manera. Así que sabemos que lo más seguro que puede ocurrir para proteger las vidas de las personas aquí detenidas es de que encontremos maneras diferentes para protegerlos, que los dejen en libertad, que les den un camino a la ciudadanía, que les den la habilidad de regresar a sus hogares mientras esta pandemia esté ocurriendo, porque simplemente no están seguros aquí adentro. No pueden participar en el distanciamiento social en sus celdas, sabiendo que hay 7 personas en una celda. Es imposible que puedan mantener la distancia. No pueden seguir los reglamentos que como doctores estamos dando a nuestros pacientes para proteger sus vidas. La realidad es de que cada momento que ellos siguen aquí adentro es una condena a la muerte. Eso no es aceptable. Así que por eso estamos tratando de hacer lo posible para proteger sus vidas, entregando estas mascarillas. Pero también es importante reconocer que tenemos que dejarlos en libertad para realmente proteger sus vidas.
Great. And Jenna?
Hi, my name is Jenna Bonfilio. I'm a medical student. I'm joining the mass delivery here at GEO in Aurora because I believe that it's important to continue to stand up for the rights of those incarcerated at GEO. We must not forget the people affected by inhumane conditions here. Especially during this evolving global event, because if anything, the pandemic intensifies the danger that prisoners at GEO face.
Mi nombre es Jenna, soy estudiante médica y estoy aquí participando en esta acción para entregar cubrebocas porque siento que tenemos que hacer todo lo posible para proteger las vidas de las personas detenidas, especialmente durante esta pandemia. Siempre han habido problemas en estos centros de detención, pero especialmente cuando está tan peligrosa la situación, es más importante que nunca que participemos y que luchemos por su libertad y su protección.
I'm Sarah Josephson, and I am a sleep technologist. In the midst of this COVID pandemic, as a medical professional, I have a moral obligation to stand up to take responsibility for our larger community, including our immigrant friends and neighbors. I do not believe that any human is illegal, and it is our obligation to do everything in our power to free those held as immigrant detainees held by ICE. Until we can free them, we must do everything in our power to make sure that detention is not a death sentence. We know ICE's record. It's abysmal in terms of maintaining the health and safety of the detainees. That is why I am participating in delivering these 510 masks to the GEO ICE facility in Aurora today.
Mi nombre
Thank you
es
so much.
Sarah Josephson. Soy una trabajadora médica. Específicamente trabajo relacionado a los pacientes relacionados a problemas de dormir, y estoy aquí participando en esta manifestación porque siento que es una obligación moral que como doctores, como comunidad, tomemos acción. Es importante que el simple hecho de estar en este centro de detención no sea una sentencia a la muerte, pero eso es lo que está ocurriendo ahorita. Entonces, por eso estoy participando en entregar estas cubrebocas para tratar de proteger las vidas de las personas. Pero como varios han dicho, esta es una sentencia a la muerte si no dejamos salir en libertad a las personas. Pero hasta que dejen a las personas en libertad, tenemos que hacer lo posible. Y sabemos que ICE tiene un récord pésimo en proteger las vidas de las personas. Entonces, por eso sabemos de que cada día que ellos sigan aquí, esto es demasiado peligro para las personas detenidas.
Ready to carry the box in?
Ahora los doctores están por entregar la caja de las máscaras. Los acompañaremos mientras están tratando de caminar hasta el centro de detención para entregar. Ahora están tratando de hablar con los agentes de ICE para ver qué les dicen.
So yeah, we want to deliver them for.
Unfortunately, we're not allowed to accept those. So, I appreciate the gesture.
We have actual paperwork that they're FDA approved.
Understood, but if you go to ice.gov and look under the COVID-19 banner, we're not allowed to accept it. So, appreciate the gesture, but maybe there's another organization we're not allowed to.
Are they getting that?
Yes, they get 3 masks a week. 75 now? They're 13 masks. Just like I'm just saying we're not allowed to accept it. On our website. I think it's here in the website. Understood, maybe some nurses and doctors in there on the front line. It's under the COVID-19 banner.
Can you explain to me the 3 days a week of their masks? Because our understanding is that do they get to wear masks every day, or do they only get to wear masks on the days that get them? So everything for coronavirus. It was just our understanding from talking to people that they weren't getting masks. They weren't allowed to wear masks every day. It's not just to tell them to wear masks, it's that they want to wear masks.
Their decision. I wish we could compel, we can't. It's their decision if they want to make it, if they want to wear the mask.
Yeah, but are they allowed to wear
They
masks?
can wear
Do
masks.
they have masks available to wear
Yes,
every
they do.
day?
We would not take TVs, I'm sorry, man. Doesn't matter if it came from you, facility, factory, phone number, we're just not allowed to take it. The rules are on the ice, but rather than sit here and just talk about it, it's probably better if we.
Can you tell me how many people are currently in
We're not here to talk about that, this is about keeping donations.
No, we're actually here to talk about the safety of the detainees in the building. It's
14.
all available on iPad. All right, I don't believe that. I don't. How many people are in a cell right now in this building? So that is not known. So we are here to talk about that. We're very concerned about the safety of the people in this building. They appreciate the concern, but not all of our you feel that everyone here is safe, that you're protecting them? I think so to be what to do about it, but so again, we appreciate it, but we don't have to.
Sorry.
I was just wondering if you could set things up. I think after you're available to go talk to the
For things right now, Congressman Crow does a weekly accountability for the facility, all that's on his website as well.
So they're saying that they can't accept the mask, that it's they're not able to, they're not allowed to per the requirements through the on the GEO and ICE website.
have them available.
The doctors are asking if masks are permitted, provided. They said they can't accept the masks, but that we could talk to GEO about if they can accept the mask for the guards. And let's take a few moments right here before they ask us to leave. If you want to kind of recap what they said.
So basically, they referred to the official statements, official web page, but they weren't really willing to engage in much conversation. It sounds like they are just sort of consistent, actually, with what we've heard from detainees. They are getting masked 3 times a week. From our understanding, detainees are only actually being able to wear them 3 times a week. It sounds like they're committing that detainees will be able to wear them every day. So I think we can follow up and see, are detainees actually getting to wear masks daily? They would not tell us how many people are living together in living quarters. I think that is urgent to know. And they basically were closed to conversation beyond pointing us to their website.
Yeah. Any additional comments? How you feel?
They kept on directing us to the website rather than answering questions or engaging in dialogue during this infectious pandemic. It clearly strikes me as a low effort answer on their part.
I'm not surprised, but I'm extremely frustrated by their response.
So for people tuning in just now, can you please just sum up really quickly what we're doing here today, what just happened, and what you think is going to happen going forward?
Basically, we tried, there's 500 people, 500 plus, about 510 people that we know of that are in this facility. So we attempted to bring high quality N95 masks to help ensure the safety of people here. Ultimately, we would prefer them to be released because that is really the only safe way to keep them safe. We asked them to accept the mask. They said they could not. They referred to ICE policies online and did not really engage in conversation about why they wouldn't accept them. These are FDA approved. We have the paperwork. These are FDA approved masks. We have paperwork for them, and we really couldn't get a why of why they won't accept them. Our understanding is detainees are getting masks 3 days a week, and they did actually confirm that. But surgical masks. But surgical masks, and
So those are inferior masks.
correct. Surgical masks are so they get them, but they get them sporadically, which was our understanding. I think we could try to make them accountable to allowing folks to wear the masks every single day, because my understanding is that's not happening. And they would not answer the question of what's the close living quarters. So the number of people in this facility has been reduced, and there's no reason for them to be in very close quarters. So we got no answer on that. They refused to answer.
And I'd like to make the point that the surgical masks are good for source control. So somebody who is an infected, either symptomatic or asymptomatic, coughs or breathes and it's spreading particles, microparticles, then the surgical mask can help catch those and prevent it from reaching other people. So it's good for protecting the surrounding people to a certain extent. However, the N95 masks are for protection of the wearer. It prohibits 95% of particles from getting in through the mask, and it's protective to the wearer. And these are superior masks. These are what we wear in healthcare. These are what these in-prison people should be wearing. However, they refused the donation of these masks because per policy, well, it is an unjust and unwise policy.
And I will say, this is an area where I think if we're wise, we will see that we're all interconnected. So we know that both guards and staff have tested positive here, 3 guards and 3 detainees. And masks, the guards are also not wearing the proper equipment, and we're not separate. We're all connected.
I'm sorry, I know you guys are streaming, but this is private property. We're just gonna ask you
And actually, Ana, if you could do that sum up in Spanish as we walk back, is that okay?
Yes. Yes. Entonces, los doctores estuvieron aquí, tuvieron una conversación corta con los agentes que estuvieron presentes representando a ICE y tal vez también a la facilidad de GEO. En la conversación corta, los doctores afirmaron lo que hemos escuchado, que las personas allá adentro solo reciben mascarillas 3 veces por semana, y sí confirmaron que sí solo reciben las cubrebocas 3 veces por semana, y pidieron que por favor que dejaran entregar estas máscaras, y desafortunadamente no quisieron tener una conversación y no quisieron aceptar los cubrebocas. Dicen que simplemente tienen que ir al sitio web y no le dieron razón porque no pueden aceptar estas máscaras que tenemos. Los doctores tienen toda la documentación necesaria para afirmar que sí son grado de hospitales que son aprobadas por la Administración Federal que regula las drogas, y desafortunadamente se negaron a aceptar las cubrebocas. También fueron adentro para ver si GEO aceptaría las cubrebocas para el personal que trabaja allá adentro, pero desafortunadamente tampoco para ellos se las aceptaron. Y la doctora afirma que pues es importante reconocer de que todos estamos conectados, ¿verdad? Así que si los oficiales, las personas que trabajan allá adentro están en peligro, ellos están poniendo las vidas de los detenidos allá adentro también en peligro. Así que es importante que tanto las personas que trabajan aquí y interactúan con los detenidos estén protegidos, tanto como los detenidos ellos mismos que estén protegidos por este virus. Y también afirman que el grado de cubrebocas que reciben las personas detenidas solo son mascarillas súrgicas. Entonces, la doctora clarifica que las mascarillas de cirugía. Esas mascarillas protegen para que una persona enferma tenga menor probabilidad de exponer a las otras personas a contagiarlas si ellos están enfermos, pero las máscaras que están tratando de presentar los doctores protegen a la persona que está utilizando el cubrebocas para que clarifica el aire, para que si hay alguna, los gérmenes, el virus en el aire, protege para que sea menos posible que se entre en el cuerpo de la persona usando la máscara.
And there is actually like people come back and forth between the jail and GEO here. So I would hope we would have more success with the Denver jail. So I think we should try to deliver them to the Denver jail, and I would support the legislative actions that are coming. But I'll let Anna speak to those.
Yeah, Jenna, you want to share anything?
Yeah, I mean, I was a witness to the attempt to deliver masks, and the encounter overall was pretty disappointing. I think it's even more of a testament to the fact that the individuals who are being held in GEO are really not provided any dignity or respect by the people who are working at GEO. I just hope that maybe one day our actions will give them that dignity that they deserve.
Estoy aquí, voy a traducir primero lo que acaba de decir la doctora Danielle Loeb. Clarifica que pues una vez más las personas allá adentro siguen vulnerables y desafortunadamente GEO se negó a aceptar estos cubrebocas para proteger las vidas de ellos. Lo que sigue es tal vez seguiremos continuaremos al tratar de entregar estos cubrebocas a las personas que están en las cárceles de Denver, ya que sabemos que siguen habiendo transferencias de la cárcel de Denver aquí a este centro de detención. Así que para proteger, como dice ella, estamos todos conectados. Y Jenna, la estudiante médica, afirma como testigo de esta acción donde trataron de entregar estos cubrebocas, afirma de que desafortunadamente este es simplemente otro ejemplo de cómo las personas allá adentro no los tratan con dignidad. Y esperamos que como seguimos actuando y manifestando y presionando, que algún día llegaremos a un mundo donde las personas detenidas sean tratados con dignidad. Ahora voy a dar un poco de información sobre qué es lo que estamos haciendo al nivel estatal para luchar por una propuesta legislativa que realmente traería este centro de detención y cualquier otro centro de detención en el estado bajo regulamientos estatales para proteger a las personas aquí adentro, no solo durante esta pandemia, pero en general. Como organización hemos estado luchando porque la agencia que se encarga de salud pública que tenga responsabilidad de inspeccionar este centro de detención, ya que este centro de detención ahorita no tiene que seguir los reglamentos estatales. Desafortunadamente, este centro de detención y el centro de detención en Westminster, donde tienen a niños detenidos, estos centros no tienen que seguir los reglamentos que las cárceles y las prisiones de Colorado tienen que seguir. Así que si están habiendo violaciones de salud, si están habiendo violaciones de derechos humanos en este centro de detención, el Estado ahorita no tiene el derecho de entrar aquí para inspeccionar y dar reportes de lo que está pasando. Así que estamos luchando por una propuesta legislativa que haría exactamente eso, que traería cualquier centro de detención en el estado de Colorado bajo la regulación del estado de Colorado para que la agencia CDPHE pueda entrar a inspeccionar y podríamos reportar cualquier violaciones de derechos a esta agencia. Así que seguiremos luchando por esta propuesta legislativa y esperamos que la sesión legislativa, cuando regrese el 26 de marzo, esta propuesta sea introducida y rápidamente sea hecha ley para que finalmente podamos tomar acción como Estado. So we are here because we're fighting for the protection of those who are detained. And we know that it's not just during this pandemic, right, that folks are living in vulnerable conditions. And that's why we're fighting for a piece of state legislation that would bring this facility and any other facility, including the Child Detention Center in Westminster, under the state regulation. Unfortunately, right now, this facility and the Westminster facility are not subject to the regulations that prisons and jails have to follow. And so when they're violating people's human rights, when they're failing to take care of people, when they're participating in medical neglect, unfortunately, the state of Colorado cannot go in and inspect and ensure that they're following our basic guidelines. So that's what we are trying to do right now. We're fighting for a piece of policy that would allow CDPHE, the agency in charge of our public safety, to be able to inspect these facilities now, and to be able to bring accountability and transparency to these centers. So we will be fighting for the introduction of this piece of policy and hoping that our state legislature takes swift and immediate action to protect those inside. And we hope we get the support of our community in making this piece of policy a reality. And now I wonder if it would be possible for Faven to share a quick video of one of our leaders and medical professional herself, who is out in a small town in Colorado trying to fight for the safety of her community while her husband is here in this GEO facility. And she's sharing her story both as a healthcare professional and as somebody who's directly impacted by this inhumane system. Faven, I wonder if you would be able to share that video.
Yeah, is my screen visible?
Yes.
Okay.
So those who are able to see on the phone, we're going to hear the testimony of Claudia Robles, who has been fighting for protections for her husband in the same way that she's fighting for protections of COVID patients in her own community.
Hello, my name is Claudia Robles, and I'm making this video for my husband, Luis Robles Alvarez, that has been detained in GEO ICE Processing Center since November 2019, and I wanted to make this video to share my story and struggles that my family has had since he has been detained. We have a 4-year-old daughter named Julia that Luis has been her primary care provider since she was 9 months, and unfortunately, because he is detained, we've had to seek mental health services for her. She just doesn't understand at her young age why her father still can't be home with her. It's been very hard for her, for my family. I'm a healthcare worker at Lake County, a medical assistant at our local urgent care. So it's hard to know what conditions that my husband is in detention, knowing that this virus is out there and he has asthma. And he shares a cell with 5 other detainees, so it's hard to social distance, and they really don't give him a lot of resources to protect themselves from this virus. And other health issues that he's had is migraines and teeth pain, which has had minimal or to none of medical care. So I kind of just wanted to share my story and let you guys know how ICE is really not giving them any ways to protect themselves there, and just another worry for me, knowing my husband is not being well taken care of, and my fear of this virus attacking him and him being more vulnerable. He has asked ICE a couple times to move him to a cell smaller with less people so he can try to social distance so he doesn't get sick, and he has still to this day not been answered. He's also applied for humanitarian parole, and we still to this day have not heard back, which is not okay with me. With his health, I would think that they would do this for him, since they are not giving them the tools in detention to social distance. Their social distancing is locking them in their cells for many hours at a time, which it's hard to social distance in a cell with 5 other detainees. So yeah, I just wanted to share a little piece of my story and how this has affected me my ability to take care of my community in this pandemic, because I'm having to find private daycare for my daughter since the schools have been canceled, and I'm taking care of my father that has been affected by this virus, and he's elderly, and just hope someone can listen and look into it and be able to push for more humanitarian parole for those that are more vulnerable, especially somebody like my husband with asthma. And the reason I'm making this video is I'm at work and I don't get a chance to take any breaks. So yeah, thank you for listening. And hello, my name